Hi, this is Nicole Aguirre. I'll be doing my discharge summary on a patient that I encountered during my PICU rotation this semester. This patient in the PICU was an 8-year-old female. Her admission date was 4/20/2019. The discharge date was 4/25/2019. She spent about 5 days in the PICU and was discharged on day 5. Her admitting diagnosis was a pneumomediastinum, subcutaneous emphysema, unspecified asthma with status asthmaticus, cough, hypoxemia, and tachypnea. Her discharge diagnosis was pneumomediastinum, subcutaneous emphysema, unspecified asthma with status asthmaticus, pneumonia, unspecified organism, acute respiratory distress, pneumothorax, unspecified, cough, hypoxemia, and tachypnea. The consulting services that were done for this patient in the PICU, we had consulted the pediatric pulmonologist on day 3, which was 4/23. So his recommendations were to start her on inhaled steroids, which we did. Procedures, she didn't have any procedures done, but she did have diagnostics, radiology. She had a CT scan that was done in the emergency room before admission, and then she had multiple chest x-rays while she was in the PICU. So her chief complaint was an itchy throat for 2 days, cough and congestion with respiratory distress for 1 day. The history of present illness, this is an 8-year-old female with previous history of seasonal allergies and seasonal asthma, started having an itchy throat 2 days ago. Then the following day she started having cough, congestion with respiratory distress, and increased work of breathing. Mom started treating her with home albuterol nebs every 4 hours, but did not find any relief. So mom brought the patient into the ER, and mother had also reported she had noted swelling to her neck. So the CT and chest x-ray were done in the ER, and she was diagnosed with a pneumomediastinum and subcutaneous emphysema. So the pediatric transport team went to go pick this patient up from an outside facility ER and was transferred to the PICU. In the ER, the patient was also given a dose of albuterol, and they had started her on 120 milligrams of IV Solu-Medrol. She was placed on a 4 liters nasal cannula on the transfer over here. So that was her HPI. The hospital course this is an 8-year-old girl with previous history of seasonal asthma, was admitted with a 2-day history of cough and congestion. She developed a small left apical pneumothorax, extensive chest wall and neck subcutaneous emphysema, and a small pneumomediastinum. That is all significantly resolved. Patient was treated in the PICU with IV Solu-Medrol, which has now been changed to oral. She was also treated with frequent albuterol nebulizers every 6 hours. The patient was also started on azithromycin and has completed a 4-day course. It was given for suspected atypical pneumonia. Cultures were also done, which have been negative to date. Patient's chest x-rays show resolving subcutaneous proceedings. Patient was allowed to take regular diet and has been tolerating well, drinking fine, also afebrile. She was started on a high flow nasal cannula when she was admitted here to the PICU, and was gradually weaned to a regular low flow nasal cannula, and was weaned to Rumera last night and has been tolerating it well and no acute distress. Her oxygen saturations have been greater than 93%. Her physical examination on discharge, her vital signs were all stable. She was afebrile. Respiratory-wise, she still had minimal bilateral crackles and rhonchi, but no wheezing, no retracting, no nasal flaring. CV-wise, she had a regular rate and rhythm, no murmur, no gallop. She was warm and well perfused. Abdomen remained soft, non-distended, non-tender. And neurologically, she was back at her baseline. So she was discharged home with her mom. She was sent home with albuterol, 2.5 milligrams to use every 4 hours as needed for any wheezing. And she was also sent home with prednisolone, 20 milligrams, oral BID. The pediatric pulmonologist that was consulted gave her a sample of, I believe it's pronounced Asmanex MDI for home use. It was a sample that he gave from his clinic. Her condition at discharge was stable, and she's to follow up with her PCP in 2 days, and then with a pediatric pulmonologist in a week. So for the review of everything, she kind of had a lot of different little things going on, but for the pneumomediastinum with the subcutaneous emphysema, that was all treated by the guidelines that I found on Up to Date, which is mostly just supportive care. And we provided oxygenation for her, IV fluids, and just kind of kept her comfortable with rest. For her asthma is where we could have probably improved. We didn't consult the pulmonologist until day 3. We could have possibly consulted him on day 1 or 2 of her PICU stay. And so we could have started her the inhaled steroids sooner. And we also could have started her on Singular daily for her long-term control that we didn't start her on. And also for her discharge instructions, we also told she was not allowed any physical activity until cleared by the pulmonologist. But besides that, I think everything else was handled okay. For the pneumothorax, because it was small, the recommendations weren't to do anything, to just leave it with supportive care with the pneumomediastinum and subcutaneous emphysema. And that's it. Thank you.